Well, we've now reached the end of our first 100 days of bringing the Partnership Foundation Trust and North Cumbria Acute Trust together.
So one of the things we've really tried to do in the first 100 days is to massively increase the communication with our staff.
Over the past 3 months, we've spoken to about 1,000 members of our staff and key partners in the community and in local government.
One of the key messages to say to us is about maintaining the culture and the values of what we're doing.
However, many of our staff working in some of our key services were concerned about the uncertainty about future service changes. Also quite a lot of concern as to how we're actually going to engage with the third sector and the voluntary organisations with whom we work very closely.
One of the great things that's been happening in the first 100 days is our learning together. Not only do we have CLIC, which in CLIC we've trained 11,000 people over the last 3 years, we also have listening interaction, an improvement programme that's spreading, and we're doing a number of projects together across both trusts.
So winter, of course, is always really challenging across our organisations, and jointly we've been working very closely with our partners both in community and in adult social care. We have had some great success this year in securing some national funding, and we are utilising that to make sure that the patient pathways are as seamless as they possibly can be, and that patients spend as little time in hospital as is necessary.
And what we're looking to do is to bring our teams together so that we can develop new ways of teaching and learning and help people develop new roles to deliver the work that we need.
So of course as we move forward, recruitment remains a real challenge for us in the organisation, both in community and in acute services. However, we have seen some real great recruitment campaigns this year. Our teams have been working very hard both on local, national and international recruitment, and we have launched a really innovative way of thinking around this, and we want our prospective workforce to be thinking, is this you?
As you'll be aware, we continue to have significant financial challenges, but I'd like to thank the staff for the support and dedication and the ideas they've come up with to help deliver CIPs to date. We're bringing together the non-clinical areas to help support and share learning so that we can continue to work towards the achievement of our financial planning year.
What we're committing to in the next 100 days is to continue this conversation with our staff and listening, and a key part of that is to listening to our staff. So in January we'll be launching a further series of events called This Is Us, when we're going out listening to different teams and getting their views.
We're really clear that as we go through the next year, we're going to be increasingly aligning our services in the south of the county and in the north of the county. We've received some draft commissioning intentions from the CCGs in the north and the south of the county, and they clearly are directing us in this way towards a north and south organisation of our services. And then from April 2019 we will be increasingly organising our services around the configuration and developments in the north and the configuration of services and developments in the south.
We've started to have conversations with our colleagues in the big mental health providers in Lancashire and in the North East so that we can pool our expertise and our resources to look at how we might more effectively deliver services for people who've got mental illnesses and people who have learning disabilities. And we're aiming to have those conversations going early in the new year.
The partnerships with other trusts, for instance cancer services from Newcastle, working in partnership with them, and we're exploring other opportunities.
We do have some clear principles for the future of our county-wide services that are included in the commissioning intentions from our commissioners. Most importantly, we need to make sure that our patients are at the heart of everything that we do. We need to make sure that our services are delivered locally, feeding into both the north and the south systems, as well as our integrated care communities. After speaking to our senior clinicians and managers in our specialist and our children and families care groups, we know that the best thing for our patients is for our teams to stay together. with the exception of our diabetes service, which is better aligned with the acute trusts. But we need to have further discussions about where the best place would be for these services to sit.
One of the things I'll be focusing on is making sure that our support services become integrated support services. That means, as we join up patient care and making patient care seamless, the support services we provide should also be joined up. And we're going to do that by supporting as many people as possible, look at how they're currently working and making it better. That means becoming more efficient and actually achieving more things by working together than separately.
We'll be keeping both trust values for the time being, but building and working and building on these. It's not what's written on paper, it's how we behave, how we treat each other, how we work in teams.
So over this first 100 days, we've learnt a lot, made a lot of progress, and set many things up for taking our programme of work forward on behalf of our patients and our communities into 2018.